It's not that long ago that children with heart disease didn't even survive infancy. And we've come so far. Now the expectation is that children, even with complex heart conditions, will survive into adulthood. We've found that many of them will have specific problems with hitting their milestones, motor milestones, language milestones, cognitive milestones.
Anytime that you have a child who out of the gate has a lot of medical complications, it puts them at risk for potential impact on those early developmental skills, as well as impact in their development and learning.
It takes more than just doctors to get these kids to where they need to be, to where they deserve to be. You have to focus on the whole child, the whole family, and the NICU-Cardiac Neurodevelopmental Program is a way to do that. In the early childhood clinic, we're much more focused on making sure that kids are learning to walk and talk and socialize appropriately in those early years. Whereas the older kid clinic, the child and adolescent clinic, is much more focused on academics and on school and also on mental health. Many of them have a very specific set of challenges with school. They're not usually severe, not in any single domain, but subtle difficulties in multiple domains that add up to overall be a challenge that can really make it more difficult to succeed. The Jaeger family is a great example of the kind of kids that we're able to help. Joey has classic congenital heart disease that was diagnosed when he was a little baby. So we knew from the beginning that he might face some of these challenges. Lily, on the other hand, was kind of unexpected. Her heart disease wasn't diagnosed until later, but she's had a lot of problems with anxiety related to that heart condition. We're very fortunate that we've been able to bring together a multidisciplinary team of specialists into one sort of marathon appointment, which means that not only do you get to see them all at once, but then they get to talk to each other, so that the plan that we're making, it really encompasses all of the problems into one integrated plan. We have to evaluate all these different domains. So families should expect the first visit to be a full day. It's really designed to give you a team. You have a set of people who understand your child, have your back, and will walk that journey with you moving forward.
We start mostly by obtaining a history, talking with parents about their concerns, evaluating the child's development through question and history from parents, as well as any additional information from schools or outside therapists that have previously evaluated them.
All of the patients do a standardized test called the BOT, and it looks at fine motor skills, precision skills, coordination, strength, balance. We also look at grip strength to see how strong the patients are in general, and then we do a 6-minute walk test, which assesses the patient's endurance. However often our patients come back, we repeat the tests so that we can track progress over time. We really determine, do we need to send them to someone else within our group that can do further in-depth developmental or neuropsych testing? Do we need to link them with therapists, or do we need to go back to some of the services that are out in the communities?
It takes a lot of the stress out of it. It takes a lot of the confusion out of us having to advocate for ourselves, even down to paperwork that needs to be filed with schools and physical therapists. We now had advocates for us, and it was an amazing feeling.
What I do with parents is share information about what their rights are, what their responsibilities are within the public education system. I'm actually able to travel to their community and join them in meetings in person in their school, and even go as far as observe their child in the classroom to actually see how things are going outside of the clinic walls.
Until you are a family that has somebody who is sick or a child who is sick, you don't realize how much it's needed and how grateful you are.
With the clinic, it brings your hospital experience to a whole new level.
It takes an eye for social determinants of health, mental health, quality of life, in order to give children the best opportunity to have a good life outside the hospital, which is why we're all here. I'm so proud to be part of a clinic that's its central mission, and that is making a difference in that every single day.